Ladies and gentlemen, it's that time of the year, especially in the national capital, where you start worrying about your elderly parents, your children, and yourself as well. There are all these ads that will start appearing in the newspapers about the air purifiers, the air quality index, once again touching the worrying signals or the worrying quotient as far as the national capital is concerned. The India Meteorological Department and the Indian Institute of Tropical Meteorology have said the air quality in Delhi is likely to dip and enter the very poor category on October 23rd and 24th due to unfavourable meteorological and climatic conditions. This has prompted the Commission of Air Quality Management to invoke Stage 2 of the Graded Response Action Measures. Now, the anti-pollution measures will be implemented in the entire national capital region. Under this, the Air Quality Panel has asked authorities in the NCR region to increase parking fee to discourage private transport and enhance the services of CNG or electric buses along with metros as well. But before we go on, let me very quickly, in fact, just give you a sense of what GRAP Stage 2 is. There is water sprinklers which have now been used on the roads. There is ban on any kind of diesel gensets as well. They cannot be in fact used. Apart from that, if the situation gets worrisome, then of course, apart from encouraging public transport, the construction activities are also being regulated. Now, parking fee, as we told you earlier, of private vehicles have been increased. Sprinklers are being used very, very frequently. Open burning of solid waste, biomass is also now banned as far as the GRAP the Stage 2 is concerned. But this is an yearly phenomena that Delhi faces. We have been hearing time and again that that public transport would be made better, though there are new buses being bought by the government of Delhi, but they are still not at par what is required. 10,000 is how much the DTC should have at this moment. Also, with the new buses, electric buses also coming in, it's hovering around 7,500, 8,000 mark as far as the national capital is concerned. How careful we need to be, and because if you remember in 2019 when the pollution situation in Delhi was on a continuous very, very bad spell, at that point of time the Supreme Court had said that it is almost as taking explosives and killing your people. It's better than the situation that the people of Delhi were facing at that point of time. Let me at this moment also bring in our experts to try and understand what are the precautions that you can take and what immediately needs to be done so that this air emergency, we do not stand at the precipice that we stand every year of an air apocalypse. Joining me at this moment, Dr. Vivek Nangia, Principal Director and Head of Department of Pulmonology at the Max Super Speciality Hospital. We are also being joined by Bavreen Kandari. She's an environmentalist and member of My Right to Breathe. I want to start, Bavreen, with you. You know, now almost on a weekly frequency, you will be a guest on my show. We will keep talking about it because it's that time of the year where every other week the air quality is worse than the week gone by. Are the preemptive measures that you see at this moment, are they in line with what you would expect? What else can the government do?
Ankit, these are, somehow we are actually talking about GRAP, not only talking, and even the government, we make it sound like a victory or a celebration. GRAP is not really that. GRAP is, it's actually a very clear reminder that we haven't achieved clean air throughout the year. So that is why we have come to the GRAP. And as much as the intent is, of course, good that we are, taking all those steps, but they are mostly all ad hoc measures. And what we need to clean air here is extremely important is the systemic changes throughout the year that need to be done. And I've been, of course, repeating again and again, like you said, that it's the policy, it's the implementation of that policy that is going to make all the difference. We cannot invoke GRAP and then cut 5 trees an hour in the city, or we cannot have a failed solid waste management throughout the year, or we cannot have biomass burning because obviously clean energy is expensive, whatever we're offering. So those are the kind of things that we need to. We have vacant posts in the pollution board. This is over and over the years we are talking.
Yes.
Dr. Nangia is here. He knows that our children are suffering. We have every third child has damaged lungs in Delhi.
Yes.
So why are we not even worried, and why are we not even panicking? And there are no urgent.
Absolutely, because GRAP
throughout the year.
Yeah, GRAP largely is an emergency response system. So we are responding to the air quality that we are getting at this moment. But what about making preemptive steps so that we don't come to the level where this kind of emergency does stand and stare in our face that we have to implement such measures? I'm not saying that the app on my phone is absolutely correct, but it's 337. That is very poor air quality at this moment, even when we are talking about Delhi today. But Dr. Nangia, the World Health Organization says that India has the world's highest death rate as far as the chronic respiratory diseases and asthma is concerned. In Delhi, the poor air quality irreversibly damages 2.2 million lungs, and many of them, 50% of them, are children. These are extremely worrying statistics. Any society should, in fact, in my view, should leave everything else and should only be working towards battling the air pollution.
Absolutely, Ankit. I would fully agree with you. So, if you look at the statistics, there were about 1.9 million deaths that were attributable to air pollution alone in our country in 2019. There's also a recent study which has shown that our lifespans are getting reduced by nearly 12 years because of breathing this air day in and day out. There are other studies also which have labeled air pollution as a single largest environmental risk factor to our health. Imagine an environment that you're living in is actually become so toxic that it started to harm you. Way back in 2015, when we had the then US President, Mr. Barack Obama, here in India, only for 2.5 or 3 days during the Republic Day parade. And from 25th January to 27th of January, I think just 3 days here. And when they went back and analyzed the statistics, they found that his lifespan had been expected to be reduced by 6 hours. So, 2 hours per day, and you start calculating how many hours we are existing in this toxic air. So certainly we are harming ourselves directly or indirectly. It's said to be an invisible killer, but I think now it's quite visible and quite apparent. It's no longer that invisible killer anymore now.
Bhavin, if I can bring you in, because every time winter politicians start talking about the fact that, certain things are beyond our control, it's environmental factors. But if you go through any study, whether it is the IIT or any study of the government, it tells you that largely it's the vehicular pollution, which is compounded by the environment around us, the air pockets, and of course the situations in winters, along with the other contributing factors like the farm fires. Neither on the vehicular pollution front nor on the farm fires, the government seems to not have been able to put a tab, or at least have been able to manage that. What needs to be done in that aspect?
Yes, Ankit, because we are always looking at a car-centric city. We're prioritizing a private vehicle. So that's exactly what the systemic change means, that driving a car should be the most difficult thing in the city. It should be very expensive. The parking price that you are asking for right now, the raise that they've just done under the GRAP, should be throughout the year. You should make it so difficult. That's how the most of the metro cities in the world are doing. But of course, that can be done only when we have a robust and a very efficient, reasonable, good public transport system. And so simultaneously, the public transport needs to come in. So these are the kind of changes, and the vehicular emission, and every source of pollution is critical.
Right.
We cannot ignore one and go on to the other or think that this is less. We wasted the whole couple of years in that smog tower thing. We know that has failed. We wasted money, resources, time, and again, I'll emphasize.
No, I just want to very quickly ask you on that smog tower. I mean, all of us knew that at the point it was being put up, I mean, all of us knew at the point when it was being put up, it was largely show and tell. There hasn't been any study which tells you that it effectively does in the long term has an impact as far as the pollution is concerned. And today, when we are talking about the GRAP 2 being implemented,
exactly
that
what it is
smoke
about the
tar,
smoke guns
that
and
smoke tar in Connaught Place is still not functioning because it has not been maintained well. I mean, this does tell you that the government only is reactive, not preventive.
It's not only it's not working, Ankit, it's not going to work to clean air. It's absolutely unscientific. It's not. The experts have shown it, said, spoken on the shows here, written. Everything has been said, but then it was not heard because, like you said, these are optics. These are wonderful things that look now. Even for the smog guns, the sprinklers, these are very good optics to show that the government is doing something. But it's not going to help. Because you have not worked on that the intrinsically throughout the year that needed to be done. So we are here.
Dr. Nangia, you know, for any citizen, people have given up. I mean, they basically have given up to their fate that this is what the environment that we are living in. But the question then is, what precautions can we take? I mean, that's the only solution that possibly they will come up to you and ask, what can I do? Because let's say the pollution problem is not going anywhere. So is there something that I can do to save myself?
See, I think the best and the only thing that you can do to save yourself is not move out at all during this time, especially when the air quality is so poor, when it is 300 plus. That is the time when you should restrict all your strenuous physical activities outdoors, no marathons, no cyclings, no running, no exercising. Everything should move indoors, whatever you have to do, whatever exercise you have to indulge in. We have to go away from the concepts of morning walk completely, where people go for early morning, 6 a.m., 5 a.m. That is the time when it's the most smoggy and the most polluted outdoors. You should only be moving out when it's nice, bright and sunny. Lots of people ask me about masks, whether masks would help or not in this situation. Well, during COVID, of course, we were using lots of masks, even the single, those double-ply surgical masks and all of those. But these don't really provide you protection against air pollution. If you look at N95 masks, they may provide you some protection against the particulate matter 2.5 and lesser size, but not against the toxic gases. In the air pollution, if you see, the constituents are not just the particulate matter, but also there are these toxic gases like sulfur dioxide, nitric oxide, ozone. So against these, there is no protection whatsoever. So there's very limited you can do. But yes, of course, if you have any symptoms, if you fall in the vulnerable group, then you should restrict your outdoor movement as much as possible. And probably it would be a good idea to take vaccination against the flu virus also. This is the time when flu also becomes quite rampant.
Yeah.
So it may just be a good idea to take the vaccination, especially by the vulnerable group.
That's a very, very important advice that Dr. Nangia is giving here. But in the end, I mean, everything seems to be suggesting to the people, and especially because there is an audience who is watching this show right now. They still have the means either to go out of Delhi, to have air purifiers in their house, but there are millions and millions of people on the road, and with zero understanding of what they are inhaling, what they are breathing. Are we to suggest that it will require a national sort of an approach? Because if left to state governments, we have seen in the last 10 years, nothing much has improved in our lives.
Absolutely, Ankit. And I've also heard, many times spokespersons from Delhi government who come and said that, and very clearly offered that there has to be an airshed approach. And then for that, they need the other governments state governments to come together. And of course, the PMO should, take control of this, because after all, it's a health emergency, and it's going to be work only on that. And I just wanted to add where Dr. Nangia said at that point, Ankit, is that see the seriousness of we have the challenge that the air is invisible, so we tend not to believe that it's that toxic, or it's something that we should not we have to worry about probably, and that's why citizens also are not so serious. And imagine to be playing a World Cup in this terrible air. That's and risking so many of our players. So this is I mean, this is just a like a I'm trying to give you a little rhetoric to say that yes, we are not serious. If we were serious and we really care about the citizens, and they're such very very important citizens, the players,
Absolutely.
and we don't even care about that. So
I think at least I have no doubt that whatever demographic dividend we keep talking about, a young country which can grow leaps and bounds, if we do not solve this problem on a national aggressive manner, then possibly we would not be able to reach the heights that any country can with the kind of resources and the young people that we have. It is impacting our health, not only of the elderly, but also the young children and everybody around. Thank you so much to both of you at this moment for joining me and sharing your very, very valuable suggestions as far as this air pollution is concerned. It is turning into an emergency, ladies and gentlemen. All of us have to be very, very careful.